What if I told you that the COVID vaccine you received last year is not the same one being rolled out in 2025, and that these changes could make the difference between being fully protected or left vulnerable in 2026? Sounds dramatic, but it's true. The virus hasn't stopped evolving, and neither have the scientists racing to keep up with it. Each year, just like the flu shot is updated to match the circulating strains, COVID vaccines are being adapted too. But here's the part most people don't realize. The updates aren't just tweaks. In many cases, the formulations, the way the vaccine targets the virus, and even the technology behind it are shifting in ways that directly affect how much protection you'll actually get. Think about it this way. Imagine relying on last year's map to navigate a city that has been completely redesigned. You might recognize a few streets, but you'll be lost when you hit all the new roads. The virus has been redrawing the map every few months, and unless your protection is updated to match, you're essentially navigating blind. That's why health experts are pushing so hard for people to understand not just that there's a vaccine, but which vaccine and whether it's the one designed to fight the latest dominant variants. In this video, we're going to uncover what's actually changed in the 2025 vaccine, why experts are sounding alarms about certain variants, and most importantly, what it means for your safety and the choices you'll need to make going into 2026. By the end, you'll see why treating this vaccine like last year's dose could be one of the riskiest assumptions you ever make. When we talk about the COVID vaccines of 2025, one of the biggest breakthroughs is how they've been designed compared to the earlier versions. Back in 2020 and 2021, the first vaccines were revolutionary, no doubt about it. They were rolled out quickly in response to a global emergency, and their primary focus was protecting against the original strain of the virus and some of the early variants. But as the world witnessed, the virus didn't stay the same. It kept mutating, and new variants like Delta, Omicron, and their sublineages showed us just how fast this virus could adapt. That's where the vaccines of 2025 are different. They're not just targeting one or two versions of the virus anymore. Instead, they're built to give protection across multiple variants at once. This is a game changer because in the past, every time a new variant appeared, people started worrying. Will the vaccine still work, or do we need another booster just for this new version? With the newer design, scientists have tried to solve that problem by creating vaccines that act almost like a broad shield. Instead of training your body to recognize only one specific enemy, these vaccines prepare your immune system to identify and fight off a whole range of potential threats. Think of it like upgrading your phone from having one password for one app to having face recognition that works across every app on your phone. No matter how the app looks, your phone still knows it's you. That's essentially what these multivariant vaccines are trying to do for your immune system. Another fascinating part of this development is the use of updated mRNA platforms and protein-based technologies that are more flexible than before. Scientists are now able to adjust and update vaccine formulas much faster, sometimes in just weeks, instead of the months it used to take. This means that even if the virus does throw us a curveball in 2026 with another unexpected mutation, we're not starting from scratch. We already have a system in place to tweak the vaccine so it remains effective, and unlike the early days where we had to keep rushing for booster after booster, these newer vaccines are being designed to last longer and provide stronger protection with fewer doses. What this really means for the average person is peace of mind. Instead of constantly worrying about whether their last booster is still working, they can feel more confident that their body is ready for different versions of the virus. It also means fewer disruptions in everyday life, fewer sudden waves of infections overwhelming hospitals, fewer restrictions, and a much smoother path to living normally, even with COVID still around us. It's also worth pointing out that these 2025 vaccines are being tested with real-world situations in mind. Researchers aren't just looking at lab results, they're studying how the vaccines hold up against actual outbreaks happening in different regions. That's why global cooperation has been so critical. Scientists in Europe, the US, Asia, and Africa are sharing data in real time to make sure the vaccine protection is universal, not just region-specific. So when you hear about the 2025 vaccines being different, it's not just marketing hype. It's about moving from a narrow defense to a broad, long-lasting shield that makes our fight against COVID far more sustainable. And that's the real power of this first fact. It's not just about science evolving, it's about giving humanity a smarter, stronger way to finally stay one step ahead of the virus. Fact number 2 takes us into an area that many people don't often think about, the adaptability of the COVID-19 virus and how that directly influences the vaccines we receive in 2025 and 2026. Viruses are not static, they're constantly shifting, mutating, and evolving in response to human immunity and environmental pressures. What that means for us is that a vaccine developed even just a year ago might not provide the same level of protection today. This is exactly why health organizations and pharmaceutical companies have been working tirelessly to update and refine the vaccine formulas. It's not because the older versions have failed, but rather because the virus itself refuses to stand still, and we must move with it if we want to stay protected. One of the most important things to understand here is how scientists track these changes. Across the world, thousands of samples of the virus are collected and sequenced, creating what you could call a genetic map of how COVID-19 is mutating. This global surveillance allows experts to predict which strains are most likely to spread widely. Think of it like weather forecasting, but instead of predicting rain or sunshine, they're predicting which version of the virus could dominate in the coming months. Once these predictions are made, the vaccines are adjusted to specifically target those emerging strains. This adaptability is what gives the 2025 and 2026 vaccines their edge, offering protection not just against the original virus, but also against the variants that are most relevant right now. Now, many people wonder why boosters or updated shots are still necessary. Shouldn't 1 or 2 doses be enough? The reality is that immunity isn't permanent, especially against a virus that keeps changing its genetic code. It's similar to how flu vaccines work. Every year we're encouraged to take flu shots not because the old ones didn't work, but because the flu virus mutates at such a pace that a fresh formulation is needed. COVID-19, unfortunately, follows a similar pattern. That's why the 2025 vaccines are being designed with a broader scope, trying to cover as many potential variants as possible while also extending the durability of the protection they provide. Another critical development is the use of updated mRNA platforms. These allow researchers to tweak the vaccine formula quickly once new variants are identified, meaning we no longer have to wait years for an effective response. What used to take extensive timeframes can now be compressed into months. This speed is not just impressive. It's life-saving, especially in situations where a new variant spreads rapidly across borders. The adaptability of these vaccines doesn't just protect individuals. It prevents healthcare systems from being overwhelmed, which was a major concern in the early years of the pandemic. For everyday people, this adaptability translates into reassurance. It means that when you roll up your sleeve for a 2025 or 2026 COVID-19 shot, you're not just getting a recycled version of what was offered years ago. You're receiving a carefully updated protection, one that matches the threats circulating in your community right now. This alignment is crucial because it reduces breakthrough infections, lowers hospitalization rates, and ultimately saves lives. And while no vaccine can promise 100% immunity, the updated shots significantly reduce the risks, which is exactly what we need to keep moving forward in a world where COVID-19 hasn't completely disappeared but is being managed smartly and effectively. And that's why the adaptability of these vaccines is not just a scientific achievement, it's a cornerstone of our ongoing defense against the virus. It gives us a fighting chance to stay ahead, even when the virus is trying its best to stay one step in front. When it comes to vaccine accessibility in 2025 and the upcoming years, one of the most important realities to understand is how unevenly vaccines are distributed across the world. While high-income countries often secure the newest doses quickly, many low- and middle-income countries are left waiting, sometimes for months or even years, before receiving widespread supply. This gap doesn't just affect those nations, it affects global health as a whole. Viruses do not respect borders, and if a significant portion of the world remains unvaccinated, new variants have more opportunities to emerge, potentially undermining the protection offered by existing vaccines. This is why accessibility is not just a humanitarian concern, but also a critical piece of global safety. In 2025, we've already seen how organizations like COVAX and regional alliances are trying to bridge this gap, but challenges remain. Issues of patent rights, production costs, political tensions, and logistical hurdles like transportation and cold storage continue to make distribution a complex task. At the same time, governments and health organizations are beginning to shift their strategies. Rather than focusing only on central hubs for vaccine manufacturing, there is now a growing emphasis on establishing regional production centers. For example, certain African and Asian countries are being supported in setting up local vaccine production facilities, which reduces dependence on wealthier nations and speeds up delivery. This decentralization of manufacturing is being described as a game changer for vaccine equity, ensuring that people no longer need to wait as long for life-saving doses. Still, it requires long-term investment, political will, and collaboration between countries, which historically has been difficult when national interests take priority over global cooperation. Accessibility is not only about supply, it's also about affordability. In 2025, the conversation around vaccine pricing is becoming more urgent. Wealthier nations can afford to purchase millions of doses at higher prices, but for countries struggling with limited healthcare budgets, high vaccine costs can lead to difficult trade-offs, forcing governments to choose between investing in vaccinations and addressing other pressing health needs like malaria, tuberculosis, or malnutrition. To tackle this, some pharmaceutical companies are offering tiered pricing systems where wealthier nations pay more, subsidizing lower costs for poorer nations. While this is a step forward, critics argue that it still leaves too much power in the hands of corporations, and that vaccines should be treated as global public goods rather than profit-driven products. Another overlooked aspect of accessibility is awareness and trust within communities. Even if vaccines are delivered to a region, people may not be willing to take them due to fear, misinformation, or cultural barriers. This is particularly visible in rural and marginalized communities where trust in government institutions is low, or where myths and rumors spread faster than scientific updates. In such cases, accessibility means more than just having doses in stock. It means ensuring people have clear, trustworthy, and relatable information about why vaccination matters. Local leaders, community health workers, and even religious figures are playing a bigger role in bridging this gap, helping translate complex medical information into simple, practical terms people can trust. Ultimately, accessibility in 2025 is a layered challenge. It's about producing enough vaccines, making them affordable, ensuring they reach all corners of the world, and building the trust needed for people to actually take them. The COVID-19 pandemic has taught us that no country is truly safe until every country is protected, and this truth continues to guide the fight for vaccine equity. When we talk about the future of vaccines, one of the most exciting developments that stands out in 2025 and moving into 2026 is the rise of personalized and next-generation vaccine technology. Unlike the earlier days of the pandemic when vaccines were created in a one-size-fits-all manner, science is now moving toward tailoring protection in ways that match different age groups, health conditions, and even genetic factors. Think about it this way: just as you wouldn't prescribe the same dosage of medicine for a child and an adult, the same idea is being applied to vaccines. The doses, formulations, and delivery methods are being designed more intelligently, based on who needs them and how their bodies respond. That's revolutionary. For instance, older adults often have weaker immune systems, which is why they didn't always respond to early vaccines as strongly as younger people did. In 2025, we're seeing vaccines that specifically target these groups with enhanced immune-boosting adjuvants, which are ingredients added to make the immune response stronger and longer-lasting. On the other hand, younger people or those with robust immune systems are getting lighter formulations to reduce side effects while still providing full protection. This shift is not just science fiction. It's already happening with pilot trials in Europe, the US, and Asia where doses are being optimized for different demographics. Another fascinating aspect is the way mRNA technology has evolved. In 2020 and 2021, mRNA vaccines were hailed as groundbreaking, but they were still in their early stages. Fast forward to 2025, and scientists have learned how to stabilize mRNA much better, meaning vaccines can now last longer in storage and don't always require those ultra-cold freezers that made distribution so challenging in poorer regions. This advancement alone has opened doors for developing countries, ensuring more equitable vaccine distribution. Imagine rural areas in Africa or South Asia finally being able to store and use vaccines without worrying about them going bad before they're even administered. That's a game changer for global health. And then there's the rise of needle-free vaccines. In 2025, we've seen the first wave of inhalable and patch-based vaccines roll out in certain countries. These alternatives are not only less intimidating than a syringe, but they also make mass vaccination campaigns faster and more accessible. For people with needle phobia, or in situations where medical staff are scarce, this is a major breakthrough. Think about it: being able to deliver effective protection with a simple patch applied to your skin or a quick inhaled spray is the kind of innovation that could completely reshape how we respond to pandemics in the future. Another powerful development is real-time adaptability. With the help of AI and genetic sequencing, scientists can now tweak vaccines within weeks of detecting a new variant. This agility means that instead of waiting months for an updated booster, people may soon receive timely vaccines that directly target the circulating strains in their communities. The speed of adaptation has gone from being reactive to being almost predictive, which makes the fight against COVID and future viruses much more proactive. So as we move into 2026, the focus isn't just on creating a single miracle shot, but on building smarter, more flexible, and more personalized vaccines that keep pace with both the virus and the diverse needs of the global population. This evolution shows us one thing clearly: the future of vaccination is not just about protection, it's about precision. When we look at the developments in COVID-19 vaccines for 2025 and moving toward 2026, one of the most striking realities is the sheer diversity of vaccine technologies now available to the public. Back in 2020, when the world was struggling with the initial outbreak, the mRNA vaccines from Pfizer and Moderna were seen as groundbreaking. They were fast to develop, adaptable to new variants, and highly effective at reducing severe illness. But by 2025, we've moved beyond relying solely on mRNA. We now have a landscape where multiple approaches, mRNA, protein subunit vaccines, viral vector vaccines, and even newer innovations like intranasal and skin patch vaccines, are being refined and deployed across different regions of the world. This shift is not only about science, it's about accessibility, global health equity, and providing people with options that suit their medical needs, regional logistics, and even personal preferences. For example, while mRNA vaccines are still a cornerstone of protection, not every country has the cold storage infrastructure required for them. This is where protein subunit vaccines have proven valuable. These vaccines, which deliver purified proteins of the virus instead of genetic material, can be stored at standard refrigeration temperatures and often come with fewer logistical challenges. Countries in Africa, South Asia, and Latin America have increasingly relied on these vaccines to expand coverage, ensuring millions of people get protection without waiting for high-tech shipping and storage facilities. In 2025, more partnerships between biotech firms and regional manufacturers have allowed local production of these vaccines, reducing costs and strengthening self-reliance. On the other hand, intranasal vaccines, which are administered through a simple spray in the nose, are emerging as an exciting tool in the fight against COVID-19. The unique advantage of this delivery method is that it provides immunity directly at the entry point of the virus, the respiratory tract. Instead of only focusing on preventing severe disease, these vaccines aim to block infection altogether, lowering transmission rates in communities. Families, especially those with young children or elderly members, see this as a game changer because it provides an easier and less invasive experience compared to injections. Imagine being able to walk into a pharmacy and simply take a nasal spray that boosts your protection for the year. That's where we're heading. Skin patch vaccines are another futuristic development that's now becoming real. These patches use microneedles so tiny that people barely feel them, and they don't require trained healthcare workers to administer. In rural areas or places with limited healthcare staff, this could revolutionize how vaccines are delivered. People can receive these patches by mail, apply them at home, and still achieve strong immune protection. The convenience factor is enormous, and it's one of the reasons researchers are pushing this technology forward. By 2026, it's likely we'll see these patches playing a major role in annual COVID-19 vaccination programs, much like flu shots do today. The diversity of vaccine options also means scientists can tailor responses more effectively to variants. Instead of waiting months for a single vaccine to be reformulated, different technologies can be combined or rapidly updated. For example, mRNA vaccines can be adjusted within weeks, while protein-based versions offer stability in areas with fewer resources. This balance creates a safety net, ensuring that no matter how the virus evolves, humanity is not left vulnerable. Ultimately, the range of vaccines we now have is not just a scientific triumph, but a social one. It represents resilience, adaptability, and the recognition that no single solution works everywhere. With more people having access to protection in ways that fit their circumstances, the world is far better prepared for what lies ahead. And as 2026 approaches, this variety is becoming one of our strongest shields, proving that choice and innovation go hand in hand when it comes to protecting global health. Fact number 5 takes us into one of the most overlooked yet highly significant aspects of the COVID-19 vaccine journey: global accessibility and equity. When we talk about vaccines, it's not just about the science of how effective they are in preventing severe illness, hospitalization, or death. It's also about how these vaccines are distributed, who gets access to them first, and how communities across different parts of the world are able to protect themselves. In 2025 and moving into 2026, one of the most important conversations surrounding COVID-19 vaccines is not just about updated boosters or variant-specific formulas, but about making sure that these advancements actually reach people, especially in low and middle-income countries where the pandemic hit the hardest in earlier waves. Consider this: while countries like the United States, the UK, and much of Europe rolled out booster campaigns with incredible speed, other parts of the world struggled to secure even the initial doses. This inequality not only left millions vulnerable but also gave the virus room to spread, evolve, and create the very variants that later threatened everyone globally. That's why experts often say, no one is safe until everyone is safe. If vaccines are unevenly distributed, the virus finds places to thrive, and when it thrives it mutates. And those mutations, as we've seen, don't respect borders. The good news is that by 2025, we're seeing remarkable efforts to close this gap. Manufacturing capacities have expanded in regions like Africa and South Asia, which means vaccines are no longer as dependent on Western supply chains as they once were. Organizations like the WHO and Gavi are also pushing newer agreements to ensure that updated vaccines, particularly those designed to combat emerging strains, are not limited only to wealthy nations. There's also growing innovation in vaccine technology itself. For example, the development of heat-stable vaccines that don't require ultra-cold storage makes it much easier to deliver doses to remote villages or rural communities where infrastructure is limited. This is a game changer because logistical barriers were one of the biggest hurdles during the earlier vaccine rollouts, but accessibility isn't only about geography. It's also about trust and education. In many places, vaccine hesitancy still lingers, driven by misinformation or fear. That means part of accessibility also involves communication, ensuring people understand why updated vaccines matter, how they protect not just individuals but entire communities, and why getting boosted in 2025 and 2026 could make the difference between a small outbreak and a massive wave of illness. Governments and health organizations are investing heavily in community-based campaigns to counter these fears, often working with local leaders and healthcare workers who can connect with people on a personal level. At the same time, there's the question of affordability. While many nations subsidize vaccine costs, there's still debate around intellectual property rights, manufacturing patents, and whether pharmaceutical companies should share formulas more widely to allow generic production. The push for more open collaboration is strong because, again, the stakes are global. Ensuring everyone has access isn't just about fairness. It's about reducing the chances of another dangerous variant bringing us back to square one. So when we talk about COVID-19 vaccines in 2025 and 2026, the story isn't only about the science of making them better. It's also about ensuring that better vaccines reach everyone, everywhere, regardless of their country's wealth or infrastructure. Because at the end of the day, a vaccine in a vial doesn't save lives, it's a vaccine in an arm that makes the difference. So there you have it, the top 5 shocking facts about COVID vaccines in 2025 and 2026. From dual-purpose shots and mandatory boosters to hybrid immunity and Big Pharma's billion-dollar strategies, the future of vaccines looks more complex than ever. What do you think? Would you take these new vaccines or wait it out? Drop your thoughts in the comments below. I read every single one. And if you found this video eye-opening, make sure to like, subscribe, and share with friends who need to hear the truth. For more health updates that can change your life, check out the next video on your screen right now. Stay healthy, stay safe, and I'll see you in the next one.